Welcome to Health Systems CIO's interview with Jordan Ruch, CIO at AtlantiCare. I'm Anthony Guerra, founder and editor-in-chief. Jordan, thanks for joining me.
Happy to be here.
All right, very good. You want to start off by telling me a little bit about your organization and your role?
Sure, I'd be happy to. So, AtlantiCare is a health system in southern New Jersey. We are the region's largest healthcare organization and the largest non-casino employer with more than 6,500 team members and providers. We have a little bit over 110 locations, and we're really excited about our partnerships with institutions like the Cleveland Clinic, Rothman Orthopedics, Drexel University, and the Global Neurosciences Institute. These are all partnerships that are through our Vision 20 and the Vision 2030 initiative that I'm sure we'll talk more about today.
Yeah, we definitely will. All right, so the reason I reached out to you, you put up a post on LinkedIn. You referred to some successes you were having around ambient clinical AI, so I figured I'd reach out and have a little chat with you, and we can get into um, what you're doing in that area. Would you say that the driver, before we talk about what you're doing, would you say that the driver for these things is the burnout, the sort of the burden, the cognitive burden, the burnout, clinicians, nurses? These are the employees that we're, as CIO of a health system, these are the folks that we really want to make sure we are providing the best tools for to give them the best work experience possible so they're the most effective at their roles as clinicians and we get the best patient care. It all kind of dovetails nicely. But it seems to be one of the driving things for IT executives in health systems, very strong focus on burnout and being overburdened. And oh, here comes ambient AI, generative AI. This could be a great tool, and it seems to be in certain areas if we're picking the right spots. But I'll let you jump in there and start explaining your thoughts.
Yeah, I think that unfortunately, the work that we have been asking our clinical teams to do in the EHR for many years, I've been doing this for about 25 years. Um, and unfortunately, in some ways, the EHR has come between our patients and the care providers. So, not at all our intention, but unfortunately, that's the reality. Uh, so, physician burnout is real, provider burnout is real. Studies consistently show physicians spend twice as much time on electronic documentation and clerical tasks as compared to providing direct patient care. So, a study from 2023 in the Journal of Internal Medicine looked at the amount of time needed to provide adult primary care to an average size cohort of patients. And just in order to provide guideline recommended care to those patients, as well as the required documentation, a provider would need 26.7 hours a day to do that. So we all know that's impossible. So we've set ourselves up for a situation where we can't be successful and we can't be uh, providing the best care that's possible. So that leads to shortcuts, and that leads to things that at AtlantiCare we have a intentional strategy to try to address. One of those being clinical AI agent, as you mentioned, Oracle's ambient tool for note writing, among other things. But the reality is that same scenario applies not only to providers, it applies to nursing. So nationally, nurses devote more than half their time during a shift to EHR data entry and data retrieval, and an additional 30% of their time looking for supplies. That only leaves 20% of the time at the bedside. So, you know, we're not just burying our heads in the sand. We're looking at the general state of clinician burnout and we're taking steps to address it. I think, clinical AI agent is a good example of a system that does exactly that.
All right, very good. Yeah, I've heard it said that you know when the transition was being made from paper to EHRs, things that in the past did not have to be done by the clinician all of a sudden became the clinician's responsibility, and that was probably a mistake, although probably good intentioned. And so perhaps what we're trying to do is undo some of that. Does that make sense?
Yeah, absolutely. And I think it's all been good intention. We're trying to follow, the guidelines that are set for us and the rules that we have to play by. It's just unfortunately all of those additional steps and all of those additional requirements create burden. And not until recently have we had a solution for that and a way to minimize the documentation burden. We just keep adding more and more and more and more. We're never taking away. So um, it's not a problem that I think is going to be solved overnight or by one thing. I don't think that the ambient tools are, a panacea, but I do think that we finally have something that moves us in the right direction. We've seen some pretty incredible results in our documentation time getting reduced based on implementing the technology.
Very good. We'll get into that a little more. I want to touch on this. You mentioned nursing. Obviously, it's a huge part of what goes on in a health system. Do you think that there could be a tendency to not give nursing the informatics care that it needs and to focus too much on the physicians? Is that something that can happen? And obviously, it's very important not to let that happen. But do you have any thoughts around that?
I think that if you look at the workforce in healthcare and in any healthcare system, nurses are the majority of that workforce. So there are, I know at AtlantiCare, and most of the other organizations that I've worked at, there is always a very significant investment and look into programs that can help the nursing colleagues and the informatics colleagues be more efficient. I don't I don't get the sense that there is a hierarchy and more investment and more time is spent on the physician workflows. But I do think that some of the nursing workflows are more challenging to automate.
Hmm.
And that may be some of the reason why it feels that way. But I can tell you from my position that the nurses are the majority of the workforce, and they certainly get the attention that they deserve.
Is that because it's less sort of episodic and it's more continuous, the nursing interaction with the patients? And physician might come in when they're doing rounds and do specific things and then leave. And that was so there's almost a beginning and end where the nursing interactions are continuous. Is that why it's
Yeah,
more complex?
I think it definitely that has something to do with it. I also think that the tasks that the nursing team is executing are just a lot more physical and a lot more complicated to automate. If you're
Okay.
administering medication, there's only so much you can do to make that process more efficient. And we've done our best through Pyxis and the med dispensing devices to make that process more convenient. But there's just a lot more movement. There's a lot more physicality in that work.
Mm-hmm. Okay, very interesting. So let's talk a little bit about the Oracle Cerner. So you were on Cerner before the Oracle acquisition?
Yep.
Okay.
Yeah.
So, I interviewed another CIO recently who same boat uh, on Cerner. Oracle comes in, buys it. He said he has seen a market improvement in responsiveness, in all sorts of stuff. It was all positive. His description of the acquisition, which doesn't happen all that often. A lot of times when there's an acquisition, existing customers of the company that's acquired see the opposite of improvements. But that's not what he said. Do you have any thoughts around that? Do you feel the same way that the acquisition has been a positive and made Cerner stronger?
Yeah. It's a really interesting point of comparison. So I've before my work with AtlantiCare, I was the chief innovation officer and chief technology officer for one of the largest health systems in New Jersey. and actually implemented Epic. So I led the conversion. I was the IT lead for the conversion to Epic. So I have sort of a fresh understanding of, that platform and its strengths and its weaknesses. And when I came to AtlantiCare, that was obviously something that I was interested to learn more about. I had dealt with Cerner a lot over my career, just like I had dealt with, GE and Allscripts and, you name it. But it's been very interesting to learn a lot more about what the Oracle acquisition of Cerner really looks like behind the scenes. And I mean, I can tell you with 100% certainty that Oracle and Cerner had a lot of differences as organizations. And I would say only over the last maybe 6 to 9 months have we really started to see a significant shift from the Cerner that I knew from, a million years ago, working with all these technologies for so long. The Oracle methodology is very different. Um, and I think that's why, there's been some, I would say, change happening in how services are delivered. Oracle as an organization, since they acquired Cerner, they haven't missed a development deadline. I mean, that's not something that, the Cerner of the past could say. They made a lot of promises and they did everything they can do to make the customer happy. And sometimes that meant stretching deadlines, and sometimes that meant, you know, going up to the wire with development tasks. Oracle's methodology is a lot different. It's a lot more scripted, and it's a lot more controlled, and it's a lot more reliable. So I've definitely seen a big difference. Um, and it's also evident in the product. So the product has also changed. Um, CAA is a good example of, one of those differences. I've worked a lot with other ambient tools that are out there in the market, but they're always a third party, right? You're integrating a tool from a third party into the EHR. CAA is different, right? It's made by Oracle. It's part of the EHR. It's actually a foundational element of the EHR, that AI technology. So that's a big difference. Um, and that's a big difference that can really be leveraged across all of the products that Oracle offers. So I would agree with the previous CIO that you interviewed that there's a big difference in the new way that things are being managed. Um, at Cerner, now Oracle.
Very fascinating. It's just completely fascinating what's going on. Um, so Epic has been the juggernaut, completely owning the space, dominating the space, signing everybody. Everybody switches from whatever they're on to Epic. Almost never do you see a switch off of Epic to anyone else. You don't see it. And
Yeah.
I said that's when we know things have changed. If we see someone saying they're coming off of Epic and going on to Oracle, that would be sort of an earthquake in the industry. But let me ask you this: so the reason many people go with Epic, um, good product, good service, reliable. It sounds like the Oracle acquisition and the changes that are being brought could be moving the company towards that Epic-like feel in terms of quality. What you mentioned is service, but you're also talking about product with upgrades and updates and things that are native as opposed to bolt-on integrations. Um, so, do you think they're going to give Epic a run for their money?
Epic's got a great product,
Yeah.
and there's no arguing that. There's no way around that. I think that the biggest difference in my experience has been the methodology, though, not necessarily the product. So it's a tool. Um, you know, Lots of EHR vendors have tools, particularly in the ambulatory space. As you know, there's probably 100 different tools that are used in the ambulatory space. Um, and it is just that, it's a tool. The implementation methodology is really what's so different and what has historically been so different between Cerner, now Oracle, and Epic and Allscripts and some of the other ones that used to have more of a market share in the acute space. The implementation methodology that Epic uses is very, very highly measured, very highly fine-tuned,
Mm,
and scripted. So you know what events you're going to schedule, and you know what you need to make time for leading up to every go live. And down to the agenda, because of all of the implementations they've gone through, they have a model for,
mhm,
and they have a best practice for that. That's really what the biggest difference is from my perspective. The tool itself is pretty similar.
mhm.
It's really the methodology that's a lot different.
And so the methodology, Oracle is helping improve the methodology.
That's exactly right. So, Oracle is a very capable organization that has, international clients and, software way far beyond what Epic has in terms of capabilities.
Mm.
Because they do the full, ERP suite. They do a lot more than just the clinical EHR space. So I think yeah, the big learning has been that methodology and that implementation strategy that the product is being able to now take advantage of.
It's interesting. You remind me exactly of the CIO spoke to I told you I was talking to him about the impact Oracle had on Cerner and the tone that is used to describe Oracle is the same one you're using, which is I don't know if I'd say reverence, but it's certainly uh, quite impressed with.
Mhm.
That's how he spoke about Oracle too. It's like they know what they're doing. They're impressive. They've got a lot to bring to the table. So it's really interesting just the way that company, um, the way IT executives like yourself see Oracle. It's with a lot of respect. Does that make sense?
Yeah, absolutely, absolutely. I think we've all, at least people that have been in the industry for a long time, have a lot of experience with um, vendors maybe not meeting their commitments or disappointing us. And ultimately, as stewards of the organization, I mean, that's on me as the CIO, right? That's on IT as a division within the organization. We take that responsibility and we are stewards of the organization. So if you have a relationship where a vendor keeps not meeting their commitments or disappointing you, or it's just not working how they said it should work, at a certain point, that's not sustainable.
Hmm.
And I think in order for the market to sort of rebalance, that needed to change. And I think fortunately, I've started to see that change, and we're witnessing it as part of our Vision 2030 program is powered by Oracle. So if there's a product that's available in the healthcare space that Oracle offers, the likelihood is that we're going to be using it at AtlantiCare.
Very good. So I wonder if organizations that were Cerner customers, perhaps were on the fence about the future, maybe they saw themselves at an inflection point, say, "Hey, we see the acquisition happened. We're going to take a look. We're going to watch things. If things go downhill, we're going to consider Epic. If the ship gets righted, we're going to stay where we are." It sounds like maybe some people who were in that position are at least going to let things play out a little further. There's been enough positive to say, no, we don't need to go down the Epic road right now. Let's keep
Yeah.
keep where we're going. And that's what you're doing with your 2030 initiative. Oracle now, you're sort of all in here, full partner, like what you're seeing so far. You mentioned um, rolling out 60, 20 new major solutions and over 60 capabilities through the partnership with Oracle Health. So it's on, as they say.
Yeah, it certainly is. And I think we have um, we also had to build some governance around that.
Okay, tell me
right?
about that.
So there's always new requests for software. There's always new requests for new technology. And one of the ways that we can sort of protect that investment is to, review those requests and make sure that we are sticking to our preferred partners when it's possible to do so. So we have a group that we call Shark Tank that reviews our new requests for software with a particular focus on systems that are outside the Oracle umbrella. So we spend time to review the project budget and the resources that are required for that implementation. But we also make sure that when possible, we stick to our preferred partners. So, and if, as any organization knows that has gone through a standardization process before, or maybe, a merger or an acquisition can kind of motivate you to do something similar. But if you don't do that, you end up with a flea market infrastructure and a little bit of everything, which is really, really hard to sustain and be effective in. So, um, part of part of our success has been building in that governance that's required to make those decisions and to make sure that all of the decisions we make down the road are compatible with our vision.
So what you just touched on, it to me right now is one of the biggest issues, dynamics going on in the industry. It's the idea of staying in suite versus going out of suite. There's a huge tug of war here um, with innovation and the idea or the users, the departments making requests for one-off apps because it's like the perfect little tool and it's got all the bells and whistles. So a lot of times either innovation-minded folks or innovation tasked folks are coming up with things that are outside of the core suite and they want to show they're being innovative. This is how we be innovative. This is the tool that's going to make me innovative. So you have that contingent. You have folks like yourself that are in the more in the CIO position, the CTO position, who also want to be innovative. It's not that you don't want to be innovative, but you've got a different perspective and different goals, different things you're trying to achieve. So we want to use governance to get these things decided. Are we staying in suite or are we going out of suite? Um, Some people say if you get 80% of what you're looking for, stay in suite. 80% of the functionality, stay in suite. I've heard users argue, well, they say it's got 80%, but it's really got 20%. So there's really a dichotomy here, a tug of war. Um, and I'd like your thoughts on that overall dynamic. Um, when and how do you go out of suite? When do you say, okay, we're going to go out? And who makes that decision? Obviously, governance.
Yeah.
But the devil's in the details. Your thoughts?
Yeah, the devil's definitely in the details. And I think if you're operating in a space as an organization and you've picked your strategic partner should be the one to tell you, this is a place where we're not really innovating. We're not really the market leader. You should go outside. That's the signal to a CIO or a leader of an organization that you have the right partner. If your partner is the one to tell you, this is a really great space, and I see the vendor you're looking at. It makes a lot of sense. We have a little bit of it, but I always push our partners to be the ones to kind of help us guide that decision, because they're the ones that know the roadmap. They're the ones that know how it really works and how it really ends up being implemented and utilized. So I would flip that on its head a little bit and say, if you have the right partner, those decisions are going to be easy because your partner is going to be on the same page with you.
Yeah, but there's also the dynamic of the users, of the internal discussion and debate and requests coming up. We want to use X.
Hmm.
And so that's got to go into some sort of process. Are we going to use the in-suite product or the outside of suite product? The users are saying they want the outside of suite product. How does that get vetted out and ultimately decided? It can't just be you asking the vendor, "Hey, is this good enough?" And they go, "Yeah, sure." right? I
Yeah.
mean, it's got to
Yeah.
be. Go ahead.
That's exactly right. And there are times where, based on a department's request, you do have to go outside of the suite because there's not a counterpart to it, or it'll take a few years to get there. So, and I think that's why you need a multidisciplinary governance group, like what we use and are calling Shark Tank, to do that review, and to do, because that review is not just looking at the budget and not just looking at, is there a corresponding product? It's also looking at the workflows. It's also making sure that what we're planning to invest our time and money in is something that has a reasonable workflow, and it improves something. It can't just be an add-on to, part of what we were talking about before is a lot of times these new technologies are not considering the workflow. We just keep adding and adding and adding and adding. Our Shark Tank group actually goes to that level, and it's not just IT, it's a multidisciplinary group that actually looks at the underlying workflows that are part of the new implementation. And sometimes the right call is to go outside. It really is. There's a lot of software that's used in the healthcare space, as you well know, and it's not always going to be an Epic or an Oracle or a Microsoft. Sometimes you have to go outside.
When you go outside, one of the issues can be obviously integration, right? So tell me if you might have the users saying, we want to use this product. It's outside the suite, but this is the one we like. You say, okay, we took a look at it. Let's say it passes muster from a cyber point of view and say, okay, it's good enough from cyber's got no objections from the CISO, but and ultimately, you say, we can get this integrated, so you will be able to. And I'm just guessing here. You will be able to see this data in the EHR in your normal workflow. But here's what it's going to cost us to do that. There's a cost there, and not just a one-time cost, but an ongoing cost. Just so you know, that's all got to be factored in. And they may say, well, that's not really what I'm worried about. I just you see what I'm saying? So there's issues there that the user may know nothing about, may not particularly care about. Like, well, you just make that happen on your end, but you're the one who understands there's a price to pay. There's a
That's
cost.
right.
It takes money and it's going to take my people time, and it's not a one-time thing. So ultimately that's got to be factored into the decision somehow.
That's right. And then sometimes there's a future component to that as well. Sometimes there's future pain that you're inflicting by making that decision now, because it may be something that is, 6 months away on the roadmap and already plugs in with workflows you already have and with systems you already have. But yet you're making this investment now, 6 months before a product may become available. So you're kind of inflicting future pain on yourself.
Yeah. Yeah. So anyway, big debate. I mean, big sort of issue for IT executives to deal with, trying to keep customers happy while managing budget and integration and workflow and workload on your team. Um, let's talk. We're almost out of time, but let's talk a little bit about managing your team. How do you, there's a billion requests, a billion things to do. And I'm not even talking about money right now in terms of budget. I'm talking about the human beings you manage and the amount of work that can be processed by your department. How do you make sure that the work that you agree to take on can be handled by your team without burning them out?
Okay. Yeah, I mean, I think the secret is to invest in your people and make sure that you have a team that you can trust and that trusts you. When you sit down as a leadership group and you set your priorities, whether that's with input from the organization, if you have a steering group, or whether those are priorities that you set with your executive team, or whether that's priorities that you set within IT, you all have to trust that those are going to be the areas of focus for the group. And the way that you reinforce that is you measure it. Um, you can very easily know what the outcome is going to be, if it's something that is very highly measured and something that's very visible. So for me, it always goes back to governance. Our governance group, for example, we review those top priority initiatives on a regular basis and make sure that they're moving along in the right direction. Nothing is stuck and needs, kind of executive involvement or a push. But you know, you really you really can only measure so much. You can't say, "Oh, we have 100 projects this year. We're going to talk about every one of them every week." That's not going to work. So you have to make sure that as a leader, that you've invested in the leadership team around you, and that you have a trusting relationship between them. So rather than um, spending a lot of time, building out a lot of organizations try to build a bigger PMO, right? Like a bigger PMO will solve all your problems if you just get a project manager on every project. They report up to the PMO, then the PMO will report out at your executive team. We'll keep everything on track that way. But ultimately, it's really the operational stakeholders in the organization that have to be part of that program. So I say that because I've often seen that IT organizations don't spend enough time to embed themselves in operations to understand the business of healthcare. Um, by doing that, by getting out of the department, by talking to the customer, by seeing the workflows, you'll know what the priorities are. You'll know what to go back to your team and say, look, every time I round, I see these three things. Every time I look at the incidents that are coming in, we see these five things. If you're not focusing on that, if you're not focusing on the voice of your customer, if you're not focusing on what people hear every day when they walk around the organization, then you're off track. And so you have to intentionally invest in those things. You have to intentionally surround yourself with leaders who are passionate about those things, and the results will follow.
Jordan, that's absolutely fantastic. Great conversation. I'm sure our listeners and readers are going to really enjoy it, and hope I can reach out to you in the future. So thank you very much for your time today.
Yeah, likewise. Good to see you.